Now, let's go ahead to the frontalis muscle. And the frontalis muscle, I'm using these great ComfortTox syringes, and these are 31 gauge syringes, and you can see these syringes right here. So with this, I broke this up. She's got 8 injection sites. We're going to go ahead and give her 8 units of Botox, which is what we've determined. But I'm using 2 syringes. Because they are 31 gauge, they do tend to go ahead and get dull a little bit. I want to be known as a very comfortable injector. So I'm going to go right next to this dot. I like to pull this skin tight. Sometimes you've got, if you can, grab it a little bit. So it really depends on you and your injection technique, and you can try different methods once you get going on this. I like to pull the skin very tight, and then with this 31 gauge, slip right underneath the skin, and we're just going to go ahead and give her a unit right there. A little bit of bleeding, so we're going to wipe that away. And just because it bleeds in one place, that does not mean they're going to bruise. And I could go throughout their entire face with very little bleeding here, but we just want to wipe that away. There we go. Next one. And I'm going to go ahead and just go right next to this. And you can see that one didn't bleed. So each one's going to be a little different. How are you doing there, Nicole?
Good.
Great. You're going to feel a little pinch there. And again, I'm going in from the side. You can go in from the front. You can go in from the side. Doesn't make a difference. But with these injections right here, you don't want to go ahead. If you do touch bone, you want to go ahead and just, bring it back off the bone a little bit so you are not under a periosteum here. So let me just wipe those away. We have 4 more, and I took a brand new ComfortTox syringe to make this a little bit more pleasant for the patient. Another pinch. Sorry about that. She is a terrific patient there. There's another pinch. You are doing just great. One more here, and one more here. And that is the frontalis injections. These injections do not take very long. And again, I'm going to wipe away these dots. You don't have to at this time. I don't want to put a lot of pressure on. But again, if there is any bleeding, and you can see the bleeding on this one side has already stopped, then we don't want to move things around, but we do want it to kind of get spread out just a little bit. So those are the first injections that she's had. And now we're just going to keep going, and we're going to give her injections around the eyes, and she only needs 1 unit in each area around the eyes because she has a very fine line, and we don't want it to get worse. Turn towards me there just a little bit. For this, my technique pretty much is really going ahead and pulling the skin very tight. And this way I can slip right underneath it here. Here's her lateral orbital rim, about 1 to 1.5 centimeters out. And I want to watch for any veins or anything right there. I don't see any. So I'm going to go right next to this dot and just give her a little bit, slip right underneath. Go ahead, get in there and give it. We're going to do the same thing over here. And here's her dot here. You always want to go away from the eye. So this one, you're going to go in, very close to the angle of the skin and go in this way and away from the eye. So I'm going to hold this really, really tight. So if you can see this, stay away from any veins. Going to go in there, give it, and get out. So these are all very quick injections. How are you doing, Nicole?
Good.
This is the first time she's ever getting Botox here. So, she, like most patients, a little bit nervous and not know exactly what to expect. But we talked about it being a little bit like acupuncture or anything like that. And she seems to be doing just great here. Yeah, you're doing just great here. Now, masseter injections. And I'm going to move your head just a little bit. Let's go to this one here first. Bite your teeth together for me. And just to remember my landmarks, I grab the masseter just like this. Anterior, posterior, I want to be right in the middle so I don't get into other muscles that might go ahead and, get other muscles that would make her look like she's had a stroke if they get Botox here. Now, this is 10 units of Botox that's going in here. As fast as you can give it is not fast enough. So you're going to see me give this right next to this dot, and it's going to be really fast, okay? That is, as fast as you can give it is not fast enough is what I always tell people here. So go ahead and give it, get in, get out, and that is the best way to go ahead and do these. So now we'll turn you this way, and we'll do the exact same thing on that side. And again, we use these ComfortTox needles. We searched high and low in the AAFE to find the most comfortable 31 gauge needle that also is comfortable in your hand as an injector and to the patient here as well. I'm going to bring it back up just a little bit, hold it just like that. Anterior, posterior, I'm holding her masseter. I'm going to go right in the middle, and you can see this ComfortTox needle go right in there as fast as you can give it. That is just fast in and out. How'd you do there, Nicole?
Fine.
Yeah, that's pretty good. Okay, turn towards me this way, and that is looking good. Now I've got just 7 more little areas of which I'm going to give 3.5 units of botulinum toxin around in those lips here. I'm going to start very conservative because there's no reason to be other than very conservative here. These are a little bit more pinchy. So for this right now, what I'm going to go ahead and do is I'm going to use one of these ice packs here and just kind of ice this up and just make it a little bit cold right here. And that'll make it feel a little bit better here because these are a little bit pinchy here. And because this got wet a little bit because it's been defrosting here a little bit, but that'll make that feel a little bit better. I'm just going to dry that, and these are all going to be very quick, but they are going to be a little pinchy, but I'm going to give her just a little bit of botulinum toxin in each one of these areas right here. First one you're going to feel, and again, this one I kind of grab and I move around so that she doesn't feel it as much, just like if you were giving a dental injection here. Sorry about that. I know that's a pincher. Sorry, Nicole, you're doing great. And it will be worth it, I promise you here. Great. Here you go. A little bit there. And in the final one, right there. Sorry, that was a pincher. You did great.
Not bad.
Okay, you did great. If it's gonna be a pinchy, it's gonna be pinchy right there. That's where it's gonna be the most pinchy here. So you did great. Let's not, and again, you didn't bleed at all here, anywhere here. You had a little bleeding up here, but aside from that, you're gonna be a little red just about everywhere. And aside from that, you're gonna do great. Don't touch your face. That is the biggest thing of everything we want to tell everybody is don't touch your face here.
What about activity?
Activity, stay out of the sun, stay out of, if you can, don't work out like till later on this afternoon. The first 2 hours are the most critical. So that's really, really important. The first 2 hours are the most critical. So if you want, you can put on very light makeup, make sure it's fresh makeup because you've got a lot of fresh injection sites. So you want to make sure that we don't use any makeup that's been around for a long time and can really just plug up these holes and cause any kind of infection there. But other than that, you did great.
Perfect.
Thank
you.
Thank you.